Hello. Okay, I'm going to be answering the questions for our blood pressure videos. Now, these are going to be the ones that are per YouTube. This is from Marbra, 1928. My best friend has a constant blood pressure of 210 over 120, not obese, and their blood work came back normal. Doctors even did an angiogram and everything was normal. They did all the tests they could do on him, and they basically don't know what's causing his blood pressure to go so high. My friend doesn't take his blood pressure medications because he says it makes him feel lightheaded as he's going to faint, as if he's going to faint. But when he stops taking the pills, he feels normal. I'm scared for his life. It's good to be concerned, but it's not good to be scared. So let's figure this out. Now, the difference between the high number and the low number is pulse pressure, and that's the efficiency of blood. For one, you got to take blood pressure correctly. That means you're diaphragmatic breathing, and you got to teach them how to breathe diaphragmatically. Push in on the stomach, you blow out, you breathe in, tummy fills up with air. So that diaphragmatic breathing is going to be the key. 10 to 15 minutes before you check it. Then look at the pulse pressure. Now, 210 over 120, that's a pulse pressure of 90. That means that the blood is not efficient at doing its job. So this man does have physical, chemical, or emotional stress. One of the reasons blood pressure drugs make you feel lightheaded is because it slows the heart down. I mean, that literally slows the blood pressure down to the brain. And that brain burns 90% of the body's oxygen. So his blood is not efficient at doing its job. So look at physical stress. We've got to get him to a corrective chiropractor to identify if there's a structural issue. We've got to look at chemical stress. That would be great if we had like a live blood cell analysis, but he can start juicing and blending. And since his blood is not efficient at holding oxygen, look at juicing 4 things. Apples have malic acid, clean in the kidneys. All of this got to be organic. Carrots clean the lungs. That's another blood filter. Beets are good for the liver. That's going to clean that up. And celery is great for minerals. So getting juicing, hydrating, make sure he's hydrating at least 50% of his body weight in ounces. Have him check his urine flow to make sure it's light yellow or clear. That means he's hydrated enough. And then, but that deep breathing is going to be the key. And he is going to have some type of physical, chemical, or emotional stress. Now, the body's got those regulatory mechanisms of the carotid body and sinus located in the neck. So if he does have a neck issue, a cervical issue, his body is going to have a regulatory issue. But look at the deep breathing, look at the juicing and blending, look at the physical structure of him, get a corrective chiropractor to check him out, watch his sleep patterns, which is huge. That's a big chemical stressor. If he's getting up at night to pee, he's not sleeping good. So look at our sleep restriction videos. And look at the emotional health. Plus, if he's talking while taking it, if he's got a full bladder or a cold room, look at all the other factors. And he will recover, absolutely, because the body is self-regulating and self-healing. Question 2. This is from Nadia Zoe, 1111. Dr. Bergman, what are your thoughts on wrist blood pressure machines? Do you think they read accurately? No, they don't. Okay, they're very convenient. You put them on the wrist, hit the button, bam. But different wrist sizes are going to give different readings. It is reading the pulse, but it's not reading it really accurate. I'm not a big fan of it. And plus, when you're taking it with anything, with a wrist blood pressure checker, a standard sphygmomanometer, make sure that you're diaphragmatic breathing 10 minutes before you check it. Make sure it's not a cold room. Make sure you don't have a full bladder. Don't talk while you're taking it. And then look at the difference between the high number and the low number. That's the pulse pressure. That'll tell you the efficiency of the blood. I'm not a big fan of those wrist machines. Question 3 from Kathy Hart, 2309. I've been diagnosed with fibromyalgia and have heard that it causes the brain to be stuck in fight or flight mode. And it sure feels that way. Could that contribute to neck pain, stiffness, shallow breathing, anxiety, arrhythmia, and elevated blood pressure? Yeah, absolutely. When it's not the fibromyalgia. Fibromyalgia isn't a demon attacking you. It's not an entity. You know, when I describe it, and I think it was the 4th book I wrote was How to Correct Fibromyalgia. It's an intelligent adaptation of the body to stress, and you are absolutely right on. Physical, chemical, and emotional stress put your body in that fight or flight mode. And if there's a tiger outside, you're not going to be going, Yeah, there's a tiger. No, you're going to be going, oh my goodness, there's a tiger. So that shallow breathing, anxiety, arrhythmias, elevated in blood pressure, these are all classic sympathetic dominant or stress responses. Three things you got to look at: physical, chemical, emotional stress. And the physical stress, you're going to see there's going to be an unstable pelvis and there's going to be a problem with the neck, guaranteed. Because when you're in a stress state, the muscles that run from the skull down to the sacrum on either side of the spine, they're called postural muscles. Just like a cat, it increases in tone. If they're in a stress state, human beings increase in tone in the same way. So if you have a structural deviation and you get that emotional stressor, you're going to feel it where there is a deviation. So you've got to look at the physical stressors for sure. Get to a corrective chiropractor. And then you've got to look at the chemical stressors. So there's going to be poor sleep patterns. Look at the emotional stressors. Look at our videos on neurolinguistic programming. Absolutely fantastic. You can literally reprogram your brain and you will feel better. And this is absolutely 100% a sympathetic dominant state. And that is not from fibromyalgia. It is from physical, chemical, emotional stress. You break this down and you're going to get better, and you're going to get better fast. You just got to find the stressors and you will recover, guaranteed. This is for question 4, Carolyn Rodriguez Riviera 7357. Hello, doc. Can you speak on low blood pressure? I'm having an imbalance issue. Been to every doctor and several ENT. The most I got out of any of them was vestibular migraines. Oh, God, what a BS diagnosis. My diet is pretty much plant-based, and I really pay attention to making sure I intake enough of everything the body needs. I've been doing vestibular exercises and self-care. When I have some sort of stress thoughts, I really get hot within the body. Can this be from low blood pressure? My back is against the wall. Thank you very much. It is not from low blood pressure. This is from a stress state. Now, when you look at vestibular migraines, the reason that vestibular apparatus, okay, is connected to two other things to help maintain balance. One of them is information coming up from the dorsal columns. That's the spine. So if you have a structural issue, you're going to have abnormal cerebellar stimulation, okay, and this controls that vestibular apparatus or puts more input into it. So it's vital that you look at the structure for sure. Then your body has regulatory mechanisms up here at the base of the skull and in the neck. Okay, that's the carotid body and carotid sinus. So it sounds like you've got a cervical issue, more than likely an upper cervical issue, and nobody has just a cervical issue out inside of an isolated environment. You're going to have to look at the thoracic area, lumbar, look at every aspect. You look at the physical stressors, then reprogram your brain using neurolinguistic programming or emotional freedom technique. Both of those are absolutely fantastic. And this will change that emotional stress as well. The chemical stress with a good diet, but make sure also you've got good sleep patterns. So look at our sleep restriction videos so you can reset your circadian rhythms. But your body is self-regulating. Your body is giving you symptoms for a reason. To just label a diagnosis of vestibular migraines is a complete misdiagnosis because they're missing the main cause. Your body is suffering, and you're looking at over 90% of all migraines, headaches, are coming from the neck. So you have got to get to a corrective chiropractor that's going to assess that and fix it, and you will get better, guaranteed. Question 5, and this is two of them together. And Carla Carr 5225, what is normal blood pressure over 60? And from Janie Weathersby 453. First of all, enjoying your comment. I'm 60 years old in good health. What should our blood pressure be? And from Carla, what is normal blood pressure over 60? Well, luckily, I'm over 60, so I got good authority on this. Normal blood pressure over 60 is the same as it is for any other human being. But what happens is the resilience of the tissue, because typically people over 60 have lived through greater stress. Yeah, you're talking over half a century. So what this does, this creates less stomach acid and less available amino acids. So the tissue resistance becomes a little bit, you lose that springability. And your arteries have this muscular layer in the middle that when that blood pumps through, you get that systolic and then it contracts. So that contractile tissue doesn't have the same strength as it would when you're in the 20s. Now, exercise will help this springability. Good diet will help that springability, but physical, chemical, and emotional stress, those will take a toll. The only difference over 60 is the pulse pressure is different. And that's the difference between the high and the low. Now, in normal individuals, you're looking at 40 to 60 as a normal pulse pressure. When you're over 60, it's more like 50 to 65 is going to be a normal pulse pressure. And that's the high number over the low number. But make sure when you're taking it correctly. You don't have a full bladder. It's not a cold room. You're not talking. You deep breathe for at least 10 to 15 minutes diaphragmatically, and then you're going to get an accurate read, because blood pressure is a reflection of your perception of stress. That's physical, chemical, emotional stress. And your blood pressure is going to be just fine. Question 6 from Naughty Mom 88. I love these names. Can you explain why both numbers would be very high as opposed to one or the other? And can both be lowered by deep breathing, as you explained? I am an EX-KAISER patient looking for advice. Love you, Dr. B. Thanks. God bless you, Naughty Mom. And it's spelled knots, like tying knots. Deep breathing is going to be the key. Both numbers being high, it's really, I want you to look at the difference between the high number and the low number. That's the pulse pressure. 40 to 60 is normal. So if you get 160 over 120, both of those are going to appear high, but it's really, the difference is only 40. So that's going to be in the normal range. And you've got to take it correctly. This means deep breathing diaphragmatically 10 to 15 minutes before, and then that's going to get an accurate read. You don't want to take your blood pressure when you're running upstairs, when you just woke up, when you're walking around, when you're just talking to somebody on the phone. Anything will raise the blood pressure, because that's how it works. If you go from sitting to standing, blood pressure goes up. So that taking it correctly is going to be the key. The difference between the high number and the low number is going to clue you in to the efficiency of the blood. Now, if you have something over 60 as a difference, like 160 over 90, okay, that's going to be a difference of 70. It means the blood's not efficient. So you've got to hydrate, maybe a little bit of juice, okay, maybe a little bit of water, hydrate, double check it within the next few hours. Okay, so if you're fully hydrated, you've evacuated your bladder, and then you're going to see a normal blood pressure for your status. And that means your status of physical, chemical, and emotional stress. And you'll see your body is going to regulate very, very quickly when you take it correctly, when you have good, healthy blood supply, and you're looking at the physical, chemical, and emotional stressors. Question 7 from Healing Light. What can you do about blood pressure that goes up on rising? Love your videos. Wish you were in Florida. I like Florida too. Right now, I'm in Thailand and it's warm, baby. It's warm. Okay, so when you're looking at blood pressure going up on rising, it's supposed to. You're going from, and if you're talking about from sleep to starting your day, your blood pressure has to go up. Even if you go from sitting to standing, the blood pressure goes up, because you have to, because your head is further away from the ground. So blood pressure changes all the time. It's just, you want to check it correctly. And that's the diaphragmatic breathing 10 minutes before you check it. Blood pressure will go up on the need. It will down when you don't need it. Okay. It all depends on whether exercise, your thoughts can raise it. Watch a scary movie, blood pressure goes up. And it's supposed to go up on rising, but just take it correctly, and that will alleviate any kind of fear. Question 8. My husband got in an auto accident, now has high blood pressure. Doctor wants to put him in a medication. I'm thinking it's due to the discomfort he's in or the pain medication. This is from Mama Love 207. Mama, you are right. Absolutely right on. Auto accident, that's physical stress. And today we typically treat people with a physical trauma very, very poorly. And we're talking that given pain medications, it will make you feel more comfortable, but it delays healing. And this goes into, I'm talking just over the counter non-steroidal anti-inflammatories. If you're taking the hard stuff like morphine, that will suppress lung function. And both of those delay healing. So get him to a corrective chiropractor that's going to take an x-ray, find the problem, correct it, take another x-ray to document that they fixed the problem. Typically in auto accidents, you're going to these PI, personal injury mills, that don't really correct the problem because they're supposed to bring you up to pre-accident status, and he might not have been injury-free on that pre-accident status. So make sure that you get to a corrective chiropractor. The pain medications are going to delay healing, but we don't want them uncomfortable. Look at high-dose vitamin C, great pain reliever. Look at high-dose omega-3s from small fish, anchovy, mackerel, sardine, great pain reliever. Look at curcumin, turmeric, great pain relievers. And all of these cause pain relief, but they don't destroy the joints or the body's repair process. Look at applying moist heat or ice, depending on where the problem is, and identify the problem, the structural problem, and correct it, and he will recover. And I'm telling you, man, when it comes to auto accidents, when I was hit in 91, had both my legs broken, sternum fractured and skull fractured. I was on pain meds in the emergency room for about 3 to 4 days. After that, I knew it wasn't good for me. And so, and I don't want them uncomfortable, but just there's a lot of other alternatives than taking pain medications just for pain. It doesn't do the healing. It just dulls your senses to the problem. And he will get better. Now, if you've asked a question about medications, seeing certain medical procedures, or something that might be deemed controversial, this is on YouTube. I won't be able to answer those questions on YouTube, so please visit the drbvip.com. That's drbvip.com to see the uncensored Q&A, questions and responses, and to view my response to those questions. God bless you all, and you will get better, and I love these comments.